Often we see patients in clinic presenting with lower back pain with essentially a normal MRI. So what does that mean? Where is the pain coming from? My name is Marc Musson. I'm an interventional pain physician. One of my most important responsibilities as a physician seeing patients with lower back pain is to provide an accurate diagnosis, or at least a working diagnosis with what I think is most likely the cause of their pain. If my diagnosis of the problem is incorrect, my treatment will most likely be ineffective. Obviously, before I come up with the diagnosis, I need to talk to the patient, gather some information, talk about their pain, talk about what makes it better and worse, other things that are associated with their pain. Then I take a look at the patient and do a thorough physical exam. Then another piece of the puzzle is imaging of the lumbar spine. This can be with an X-ray, CT scan, MRI, or ultrasound. Often the MRI is a good go-to if we're planning on doing any sort of interventional procedures. MRI gives us the best information on things like the nerves and the discs. Now, one thing to keep in mind, when patients are coming to see me for lower back pain, they've been dealing with this for often many months. They've seen many other doctors and other providers, people like physical therapists, chiropractors. This isn't some minor pain. This is often significantly affecting their quality of life to the point where they're needing some more aggressive treatment. So for these patients, once in a while, we'll see someone that has a normal MRI, or essentially what we'd expect to see based off their age. So what does that mean?
Oh God, what's it mean? Help me.
Does it mean they're faking it? Or does it mean it's all in their head? Or is it really just due to their inner rage? Possibly. Back in 1994, there was a study in the New England Journal of Medicine that showed a sample of 100 patients with no back pain. They obtained an MRI of their lower back. They were able to see what sort of findings they saw in people with no low back pain. They saw that only about 36% of the people had normal discs. About 50% of the people had wear and tear on the discs and disc protrusions. A very small amount of them had disc extrusions. So essentially this gives us some information on the normal aging process of the spine, the wear and tear process that's associated with changes in the disc but isn't necessarily associated with pain. So now what do I do with a patient that comes in with a normal MRI, or essentially what we'd expect to see with normal aging? Essentially what I do is I would just rely more heavily on my history and physical exam. So based on the information I've gathered up to that point, I'll likely have one or two or three things that I think are most likely the problem, and then I would talk about the next step. So next step, I could either provide a treatment with my best educated guess of where the pain's coming from, or if we wanted to be even more precise and more accurate, we'd do some diagnostic procedures. Either we'd go and numb up the structure if we think that's the problem with an anesthetic, and if their pain was eliminated almost 100%, we say, great, that's the source of pain, let's treat that. Some structures we aren't able to numb up, so we go and do this provocation. So for example, a disc is one area where we can't numb up, so we'll go and we pressurize the disc. And if that reproduces the patient's pain, then we say, okay, great, that's the source of pain. Now let's talk about the treatment. This last step is often the key to finalizing the diagnosis. And this can be sometimes challenging for a patient where they've gone through many providers and they may have been told many different things, maybe piriformis syndrome, maybe the SI joint, maybe the disc, maybe muscle. So often they're told many things, and this is a way for us to help prove to them that this is actually their source of pain. So this diagnostic block can provide very valuable information. That way the patient trusts us as we move forward in the next step with treatment. But we really want to have a good grasp on the actual problem before we commit to some of these procedures. That may be either painful or expensive. So with the true source of pain pinpointed, then we can really provide good information on what's the best treatment option. Make sure you subscribe. We'll keep trying to put out helpful information about your pain. Until next time.